When I left from Burma, we have to hiding in the jungle on the way because we afraid that the military will, knowing that we will be on the way and come to the border, and so many people just hiding and coming slowly to the border. So it takes 7 days because there is no vehicle or transport system. Just nighttime we travel and daytime we hiding. But we realized that the situation in the ethnic area is worse than inside Burma because there is no healthcare services. So when they learn about I'm a doctor, so they come and approach our team. So whatever we have, we start treating patient. And then 7 days later, we arrived to the border. At that time, almost 10,000 people from inside Burma come out from Burma and then start setting up like a temporary shelter and camp along the border area. But there has been no system in place for healthcare and food relief, and people desperately need for the relief work. We need to do relief work. So since that time, with support from local Thai community leaders and the Korean leaders, we start setting up relief and humanitarian assistance for these people, including food program and also like medical services. But at that time, we only have very few health workers come out from Burma, some medical doctors, medical students. So there is a lot of demand because people sick with malaria and malnutrition, and people have many skin infection because of the poor shelter, suffering from pneumonia. So we have been quite busy with all the medical work, and then we start do training for community health volunteer. So almost 3 months we've been busy with all the relief work and not stable. But 3 months later it's become a little bit stable. But at the same time, we start realize that not only the new arrival, there are many villages around and many people who displaced into Thailand, they need healthcare services. So since that time, we decided to start medical services, and not only the relief program, to start set up medical center or health center for this displaced population. So initially, our clients or patients are people who fled to the border during 1988. And 2 years later, our service expand to Karen state and to the community around Mae Sot area. They learn about the health service available at the clinic. So at that time, we only have medical program, just basic medical services. Gradually, we identify that there are many accompanied women, children, who we need to provide service for maternal child health. And also Mae Sot Hospital and the local public health, they learn about our services. Even we are not registered, we cannot be registered, or we work not under the public health system. They realize the benefit of the services we provide. So today our medical services provide about 100,000 cases a year, and we provide antenatal care and delivery service for about 4,000 women. And we also treat malaria. Every year we have 6,000 to 8,000 malaria cases treated at the clinic. At the same time, we train more and more health workers. Usually people living in remote village or IDP, internal displaced community, they never receive health care services or education from the government. So the international NGOs are also not allowed to access this population. So this population also, they become our partner because they also want to set up their healthcare service in their own village. So we start helping them to train them to be health workers, and then after training they go back and work inside Burma. So today we have more than 80 teams and access to 150 to 180,000 population in internally displaced community. And some area there is a little bit more stable because no active fighting around that area, like ceasefire zone, or some community is much more stable community. So in this area, we able to support the ethnic health organization to upgrade their existing facility like laboratory or obstetric emergency service. So through cross-border healthcare service or cross-border collaboration, we able to access altogether about 400 to 500,000 population in Karen, Mon, Karenni, Shan, Chen ethnic groups.